Hello, in version 19 of PostureArray, we've updated to include cervical morphology out of CBP Technique. When this is enabled, and I will show you how to enable it, first you have to be on the latest version, and what you would do is go into the settings and make sure cervical morphology is selected. Once it's selected, you must have the skull marker digitized, you must have T1 digitized, and now we'll have two more markers that you need to digitize. The sella turcica as well as the sternum point. The sternum point down here would be the sternum manubrium apex. We have the hard palate as we know, and then one of the new ones that we have is posterior sella turcica. Once you've done those points, you'll see the values in here, so we'll be able to calculate tongue-tied today, PTSIA, the pizza angle, okay? Now, where this shows up is on the doctor's impression report. So when you generate a report, because I've had some questions on this, where it will show up is on the doctor's version. So when we look at a lateral cervical or any other x-rays that morphology is digitized on, so say flexion extension or anterior or posterior head translation exercises, x-rays, you're going to have other assessment lines superimposed on the impression report only. This doesn't show up on the patient report of findings. Then when we scroll down, we have the normal table of values, okay? And we also have the new cervical morphology. As you can see, we have 73 degrees, but this person's increased to 90, so we know that they will have more of a deeper curve. Now, one of the things that you got to be aware of is that it's not the purposes of this video to tell you anything more about what it means or the implications. That's for a CBP seminar. So if you have those questions, don't even ask our tech support because they can't explain it to you. That's what seminar material is for. So with that being said, come to a chiropractic biophysics seminar and for cervical rehab or advanced, and we'll be covering those topics throughout, as well as in some other courses. But with that being said, that's how it is to digitize. You just add those other points, and then you have the cervical morphology measurements right there. Okay? For any other questions, feel free to reach out to us or email me directly at drjoe, drjoe, @posturescreen.com. Thanks.